In an era where information is power, the role played by the mass media in achieving a successful advocacy campaign cannot be overemphasized. The media remains a vital means of passing information to members of the public. In a bid to promote primary health care at the grassroots, Nigeria Health Watch, a subsidiary of the Federal Ministry of Health, has partnered with the Association of Practitioners of Community Media APCOM. On 27th August 2024, the organization met with members of APCOM at Ilukpeju Recreation Hall in Ilukpeju, Lagos State.
Just to share it, so go to the platform, you see a Google link.
The meeting also witnessed the number of participants who joined via the virtual platform. The organizers sought the support of the community media practitioners to help improve its quest in advocating for primary health care across communities.
Community media practitioners will play a very integral role in the actualization of the thinkings of the president of the country by being able to effectively and efficiently disseminate information across all communities. And so it's gladdening the heart that we are going to start to do it with the most important sector of every society, which is health. And Lagos State, and is starting with Lagos State. So it's a fruitful meeting that will be using the health sector, the health angle of the society to be able to address the challenges that borders on the society at large, and we'll be concentrating on community media. We think that whatever the government is doing, from the federal to the states and come to the local government, the community media practitioners have the capacity more than enough to be able to handle the work that is at hand. My advice presently, since we are starting with the health sector, I'll tell APCOM members and I'll tell all community media practitioners across Nigeria to stand by. We are coming to you. There's a work for you to do. The redemption of our nation, making sure that governance gets to the grassroots, starts with us. We are the ones to tell our people in our communities that this is what the grassroots is doing. Now, more than ever before, it's time for us to work as grassroots media and publishers. More than ever before, Nigeria needs us, and so let's make sure that we get to work for the betterment of our nation.
This meeting is really important. We came here to listen to the Association of Practitioners of Community Media Organizations in Nigeria, specifically the Lagos State chapter. We've heard that their community media and they're very impactful. So this meeting was really an opportunity for us to come listen to what they do, how they do, and how we can leverage this platform to ensure that Nigerians have access to health information. I think I would say I've gotten more than what I thought I would get. You know, oftentimes we think that everything has to come from top down. But one thing that is clear from this meeting is that the best approach is really starting with the communities upward. And that's one of the key things that stood out for me, which is not something I came intending to do. So that came up in the course of listening to it. I've also seen that there are people who understand these communities. One key thing about health communication is the aspect of trust. Attending this meeting has shown that these people are trusted individuals, are trusted sources. And communities want people they can see, people they know, people they can touch. And that's really been missing in the way we disseminate health information. So the aspect of trust, how communities can trust, how we can even evaluate trust and the impact of our interventions is one of the key things I took away from this. So in all honesty, this meeting was beyond fruitful.
APCOM stands at the forefront of community engagement, bridging the gap between the government and the people. It is also known as an effective tool for advocacy empowerment and fostering an informed citizenry.
Like I rightly said during the deliberation, we cannot overlook the activities and the impact of our community media practitioners in information dissemination within communities. So now that the Nigerian Health Watch has come to have a kind of a symbiotic relationship with us, so as to help promote and disseminate health-related information, I think it will go a long way to impact community dwellers positively, and to also create effective awareness, and to also educate the community dwellers, as regards health issues, as it affects their daily existence and it affects everything they do within communities. Definitely, it's going to have a positive impact in the lives of the community dwellers. Advice to the Nigerian Health Watch is to take this meeting seriously, and to also ensure that they don't just pay lip service to today's meeting. They should ensure that they allow the bond to come to life, whereby we can positively affect the lives of community dwellers through effective dissemination of information which are health related. So all they need to do is to ensure they partner with us, and let's see how this will go and affect our dwellers positively.
I bringing out the initiative that this is going to raise a serious awareness, because the younger generations, the Gen Zs, needs to be aware of this, because this can promote, boosting, and accelerate the efforts put into this. Because if more people are being aware of this, they can see reasons to part of this initiative and see reasons to get information needed by this. Because the younger generations, we the Gen Zs, are much more tech inclined. We are much more creative. We are much more creative in terms of dispensing information in terms of our community. Do you understand? So that's my own part of initiative concerning this. I mean, in my opinion, that the younger generation may be aware but not concerned. They may be aware but not concerned. So this can make them more concerned. You get me? This can make them more responsive and active towards this initiative. You get me? Beyond just being aware, they feel, okay, I have a part to play. Do you understand me? And like I said, fake news is also to the age, it's also to the younger people. They can have access to the right information too. And if they have access to the right information, they can be a tool of solutions to their community. They can bring out different initiatives too to promote health upgradedness in society and community.
It is to this effect that APCOM has formed a new partnership aimed at tackling health misinformation within communities. It seeks to empower communities with accurate health information and promote informed decision-making.
We are here today to meet with the Association Practitioners Community Media and partner and collaborate with them so that we get all our information down to the grassroots level, and also increase awareness concerning our SIAs that are also coming up. That's the integrated services that we have, that we'll be having in the community. Talking of the measles campaign that will be coming up for children 9 months to 5 years, the yellow fever vaccines that will also be rolling out from 9 months to 49 years of age, and also for the human papilloma virus vaccines that will also be given to young girls 9 years to 14 years. And also we will be doing the oral polio vaccine. This has been in continuum existence, and we will also be having a rollout of the oral polio vaccine as well for children from 0 to 5 years of age.
This partnership, no doubt, marks a new chapter in the APCOM mission to empower communities through accurate information and meaningful engagement.